Thank you. Good afternoon, everyone. Thank you for being here. Um, so I am a health geographer, and so I'm very happy to moderate this session here about space assets and AI contribution to the improvement of population health. So let us all take part in completing the mission, talking about what do we mean exactly when we talk about Earth observation data for health. Maybe we can start with some definitions. What are space assets? How do we collect them? And what can we do with them in the health sector? Aline?
Yes, thank you very much. Very happy to be here today. So first, we wanted to let you know how space assets can be used and what we mean when we talk about space asset. So the first thing that probably comes to your mind is the health of astronauts. Of course, we consider them as patient, healthy patient, but still they're patient in a very complex and confined environment. So we have to make sure that they stay healthy, that they are healthy when they leave and they're healthy when they come back, and that they can readapt to the Earth's gravity well. So we are engaging in a lot of projects concerning how they can be autonomous in their medical follow, everything related to digital twins, how we can help them prevent disease or other type of activities. So regarding artificial intelligence, that's a lot of our work, what we're doing. Other asset that you might not know of is that we can use the microgravity environment to do R&D research because there's a lot of things happening in microgravity that can't happen on Earth because we have gravity. So the crystallization of protein is different, cells aggregation are different, you can produce 3D tissues, organoids that are different and from what you can do on Earth, and you can understand mechanism to produce drugs or identify targets that you can't on Earth. And lastly, all the space assets are also coming from the satellites. You can use satellites for navigation. We all use GPS, so we kind of know well. You can use satellites for communication. In our case, in the health sector, is also how you can do telemedicine in remote areas using satellite communication, for example. And the last one, and the newest one, and maybe why we are here today, is the Earth observation data, because we have more and more satellites with a better precision, and then you can, with model analysis and computing, you can use this data to link them with health data to understand how is the quality of your air, the quality of water, and how you can relate this to specific disease to do a different kind of studies. And we have a good example later coming.
Thank you. What about you, Arnaud?
Yeah, maybe I can add something. Hi, everybody. So indeed, as Adeline said, the primary target of a space agency when it comes to health is to deal with the astronauts, to do crew health. But actually, it's a very tiny fraction of the health activities we are doing. And because we are not a health agency, but a space agency, in whatever projects we are trying to bring for the benefits of other people than astronauts, we need to involve these famous space assets. So whenever we will fund projects, because this is what we do at the space agency, will require industries and product developers that come to us to embed some space components within the solutions. Because what we want to demonstrate as a space agency is that the money that is injected into the space exploration has benefits for the whole planet and in different sectors, among which health.
Thank you, Adeline and Arnaud. And of course, Earth observation data with geointelligence for epidemiology are used and need to be used for epidemiology also. And I'm thinking especially about One Health approach, looking at climate change impact on the environment, like biodiversity, land use, green spaces, and living health. So now maybe let's focus on epidemiology applications through use cases. If you want, yes, Jessie for Geomatis.
Sure. Thank you. I'm very excited to be here with you all today. I've lost my voice recently, but it's coming back, so excuse me for that. So, how do we use space assets for epidemiology? How do we see people and pathogens? Well, the short answer is, at least for the moment, we don't. It's really about the risk of emergence of disease. And so in epidemiology, when we need to understand the risk of emergence of disease, we have to understand and be able to detect what are the environments we're going to find a health risk. Where do we find that? What are the behaviors and the context in which humans are exposed to that risk? And then also for once that risk, that exposure has happened, how are populations connected? How are people connected? How do people move? And to both either propagate a disease or even to mitigate a disease? How do behaviors change? And so each of these things we can actually extract from space assets, and it's very important, especially in resource and data limited contexts where we might not know even the population density of an area. So if you think about infectious disease, which is what we do with the EpiWise project at GeoMetis, we're working currently on the Ebola virus in the DRC. And so with the DRC, I should say. And we know that study after study has shown that one of the biggest risk factors for the emergence of Ebola virus is habitat fragmentation. And so being able to use satellites to tell when habitats are being fragmented, when deforestation activity is occurring, and crossing that with the models that, the machine learning models that, that tell us based on the host distributions where we expect to find infected animals. We can extract from the satellite images this new activity of deforestation in areas where even the government or even the local community might not know that activity is occurring, and we can we can give alerts to the public health agencies to say, okay, here there's risky behavior in an area that is known for, to be at risk for the emergence. So you might want to augment, elevate, sorry, I'm translating from French, your surveillance in that area. And then on top of that, they want to know sort of, if an emergence happens, where is it going to travel? And we can look at the built environment. So the landscape of buildings, roads, other transport methods, we can extract that information from satellite imagery to understand how fast and how far an infection might spread. And so these are very useful indicators that we're able to get out of satellite images that have very real implications for the epidemiology. At term, it can be linked to the data that does track, the individual pathogens and the individual people. So, yes.
Yes, maybe Arnaud for ESA. Do you have any examples, maybe optimizing public health policies, for example?
Yeah, so actually we have been supporting a number of projects in the field of epidemiology or data mining for social health. For epidemiology, and I transition maybe to the topic of AI, which is the core topic of today. We have a lot of images that are coming from satellites that are orbiting the Earth and measuring a number of parameters. These parameters can be gathered and built together to generate some maps, which we call risk maps or prediction maps, because they can provide some information on the vectors for potential diseases. So that's very relevant for the prediction capability. Maybe for operational aspects as well, we have been supporting the development of fast deployable labs for emergencies, in particular to fight the Ebola crisis in Congo. And for instance, the satellite imagery was very good to spot the areas where it would be the best to deploy the laboratory on the field. Then you had SATCOM to link the laboratory to main, let's say, expert centers in the mainland in Europe, because Ebola requires some fast evolving treatment, so you need dynamic response basically to the pathology. You could use geolocalization, for instance, for tracking the people, tracking the assets. So this is a very nice example of how you combine different space assets to really improve the effectiveness of the answer that you are deploying on the field. Now, we have also been using satellite data for cases in Europe. So for instance, during COVID, we supported projects to help cities fighting against the isolation of people and locating the people that were subject to vulnerability. And more recently, we have been teaming up with the National Health Services in the UK to help them, let's say, flexing their health policy based on a number of factors. So for instance, areas where it's colder in the city, where it's warmer, where you have a more concentration of people, so likely a more concentration of pathogens. And considering the amount of data coming from space, coming from local sensor networks, AI makes a lot of sense to process that and help the people that have to come up with solutions on a daily basis.
Thank you for the transition, and thank you for all these examples. I can personally testify for Santé Publique France that epidemiology needs support in data uses, data science through collaborations with data producers, data specialists, and also users. And so now, maybe for the final part, can each of you tell us about present and future collaborations, perhaps through projects you have in common? Adeline, if you want to go.
Yes, so what the message would be, we can't use the satellites data by themselves. They have to be combined with other type of data, either terrestrial data or operational data, but together they can help us to shape public policies or help some local community to make decisions on the health of the territory. So we have an example of projects where we team up with experts or companies that are providing this type of data to help them understand how the satellite data can be used, what they can do with it. And that's why also we are here today to try to tell you what you can do, what are the assets that you can use, and to link them with the right experts to be able to do this kind of work together, and even can co-fund or find funding for this type of project, because we see a lot more project on health and environment, One Health project, and we think the satellites and the data from satellites, either from images or maybe on temperature or air quality or water quality, can be taken into consideration into your more local and health data. So come and meet us. We can discuss projects and see how we can help you and how we can work together. We have projects regarding dengue, for example, where we don't follow the mosquitoes, but we can say this area, we see the temperature is changing, we have a lot of water that is helping the mosquitoes to develop. We see that the temperature is going to change in a few weeks, that the mosquitoes are going to develop. So if you have to choose one location to do procedure, then this is the area that you should concentrate your resources and your efforts. So we work on this type of project on all the urbanization of cities, the hotness of cities, how we can use satellite data to help cities develop more a better quality of life for the population, if we go that far in the process.
And I would add too that that the European Space Agency puts out a lot of information on climate change and projections, not just about the climate, but also of other changing aspects of our environment. And that really helps for what we're doing to show what the risk projection is, so that we can understand in the future what is the risk going to be, so that we can be better prepared. So it's not always just a response. And so that's really helpful as well.
Yeah, maybe what I can add. I mean, for us, is a more different position because, so as I mentioned, we are a space agency, so we are a bit agnostic of, let's say, the technologies that are being used together and that are combined with these space assets. they have to make sense for the users or the beneficiaries of the solutions. So we don't push for one or for another. So space assets can be combined with drones, with IoT, blockchain, and AI, of course, or a combination of all of these. As I mentioned, we need to show that space connected to that plays a kind of augmenting role, because then we show the relevance of space for everybody. We are a kind of procurement agency, so we offer funding to companies that say we have a clear business case, and in this business case, space plays a role. For instance, making a differentiation compared to the competitors in terms of solution, enhancing the type of use cases that can be addressed, etc. So these are elements that are for us good, because the space assets, they are used in a way that is not artificial. They really bring value. And this is something that we try to promote. And for this, we have, together with the colleagues from the French Space Agency, we have calls for proposals that are open all the year long, and that receives, let's say, good funding from us.
And I can attest that we have received such funding, but it's not just the funding, it's also the sort of business development and accelerator type of master classes in marketing and really shaping, honing our message and what our business model is in order to be successful. And that has been really, really helpful as well.
Thank you. Do you have any more maybe examples? Because we have a little bit more time, or I can conclude now.
I'll give an interesting example that that we haven't started doing yet, but it's something that really caught my eye during COVID, where and I should have said that when I talk about extracting data from the satellite images, that is very often done thanks to AI, and also when we're pulling in what are the best indicators from those data, AI and machine learning methods are really, really helpful because it's a vast amount of variables. And so the interesting example is that being able to understand how many people are becoming infected. Can we actually see that from space? Well, some people did some studies looking at counting the number of cars in the parking lot of hospitals, and that actually correlated with the rising cases. In other places where death was not very well calculated, we could actually look at the change in the size of cemeteries. I know it's kind of morbid, but that's what we deal with, mortality, morbidity. But that helps us to get at some real indicators that are really basic, that we don't have good calculations for in a lot of the world. And so these kinds of things are really helpful from the space assets.
Maybe I can finish as well on a very successful case that we have supported recently. It's from a company that I think was based in the UK that developed a system for, let's say, supporting the detection of colorectal cancer. And they used an AI-based system to help the medical specialists to detect, let's say, malicious polyps. And this was kind of complemented with SATCOM to make sure that, let's say, the investigation centers could be connected in a reliable way to a cloud where the images would be sent and then processed. And the approach was completely revolutionary. We had a kind of pilot trial. So, of course, in a medical term, trial has a lot of implications. Here at the Space Agency, what we are trying to say is that we bring the solution in a relevant environment with real people to measure the positivity of the solution, what are the impacts, basically, to try to quantify them. And the solution that has been developed was so successful that this very small company that was created by a medical doctor was then bought by Olympus Medical. So they just acquired the company because they were so yeah, impressed by the outcomes that they said, yeah, it's worth the investment. So for us, a very good success case.
Yeah, I think there's a strong message saying that the space asset can help co-innovate for Earth. So it's also our goal when we talk about digital twin, the health of astronaut. We don't want to develop solutions that are only used for space. The goal is to use it for population and health. And you can be on the ISS, but you're an isolated patient. And what can apply to you is also going to be applied on a medical desert where you don't have access. So the goal is to use this space asset and to let you know what you can do with it, so you can present us with projects that we can develop and help you identify the good satellites data if you need that, or the good environment that you need. So yeah,
I think if I jump on that, I think the two worlds have to kind of monitor each other, because space can be an enabler. And I mentioned earlier maybe the fact that you can differentiate from competitors and have like a broader solution with space. But of course, the money that is injected into the healthcare environment is much greater than what we inject into the health of astronauts. So we are, of course, carefully looking at what is being done. And as, let's say, we want to go further and further in the exploration of the universe. And the first destinations will be the Moon and then Mars. We'll have crews that will be more and more, let's say, that will have to be more and more autonomous. Because now we are orbiting at 400 kilometers above the Earth, which is actually not so far. And I think if you are trekking in Australia, the time that you will need to get to the hospital is probably greater than for an astronaut to be back in a hospital from the space station. So as we go further from the low Earth orbit, we need to have crews that are more autonomous, that will rely more on technologies. And probably AI will play a role there to analyze patterns, to kind of predict risk, let's say, periods based on, I don't know, the weakening of the musculoskeletal system due to microgravity, the impact of nutrition basically on the body, maybe the impact of radiation as well, because this is for us also a very big concern. So I think the two worlds are connected, and we'll need to make them even, let's say, closer in the future.
Thank you. Thank you, Arnaud. If we come back on Earth, many initiatives are being set up to share environmental data for health. I think, for example, of the Green Data for Health, which is an initiative from the French Ministry of Environment, or at the European level, the Copernicus Health Hub launched in April this year, which can be interesting to look at. So please get in touch with our speakers about your projects. Thank you all for your attention, and I hope it was instructive and inspiring. It's time to close the session, so I wish you all a beautiful evening. Thank you.
Thank you.